The challenges of screening is mainly to convince the politician that we need screening. Prostate cancer is the most frequent cancer in men, and it is rising in mortality. So in Germany and other industrialized countries, prostate cancer is the second leading cause of cancer deaths in men. So it's not only an indolent disease, in spite of being a cancer that is developed in elderly patients, but there are also young patients that will develop prostate cancer and going to die from it. So we need to really think about what kind of intelligent screening we need. The real challenge is to sort out all those cancers that are indolent. So what we are working on now is to find molecular predictors, and this was also tried already in the Stockholm trial, what I was referring to, but also other groups in the world are trying to figure out whether we have molecular fingerprints that could detect aggressive cancers very early. And these tests are yet to be developed and need to be investigated. So this is the real challenge, to be safe, that a man that is recommended not to undergo frequent screening at age 50, let's say, that he can be safe for the next 30 to 40 years and not undergoing frequent testing any longer. So there are still some challenges, but the direction, I think, is clear. We really need to differentiate screening. Population-based screening only based on PSA is not the way to go. So we are about to improve this, but we need a lot of research.